Okay, that's great.
All right, we're going to move right into the strategic planning meeting. And this is my first meeting as vice chair of the Central Health Board and chairperson of the Strategic Planning Committee. I look forward to working with my fellow board managers and our staff as the committee strives to improve service delivery and enhance communication and community engagement for all of Central Health's patient population. As a reminder, some of our committee members are also participating by video conference. So the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. We will now proceed to the committee agenda.
Madam Chair, if I may, I'm sorry. You need to read the time that we started. Sorry. That's on the very first page of that.
Oh, I'm so sorry. And today is January the 26th, and the time is 5:23 p.m. So first, we would like to review and approve the minutes of the December 8th, 2021 meeting of the Strategic Planning Committee. Would anyone like to put forth a motion? Dr. Matwani?
Certainly not a doctor, but I'll move in any case that the committee approve the minutes of the December 8th, 2021 meeting of the Strategic Planning Committee.
Forgive me, Manager Matwani.
Oh, no, not at all.
And a second? Yes, Manager Musaita, seconds. So we are going to receive an update from Guidehouse Inc. on equity.
Take a vote.
Oh, yes. A vote, please. Yes. So on the committee, does everyone approve the meetings from December the 8th? Aye. Thank you. That has been approved. So item number 2, receive an update from Guidehouse Inc. on equity-focused systems planning, including the Voice of the Community engagement findings. The Voice of the Community presentation is the first of 3 assessments that will serve as the foundation for Central Health's equity-focused healthcare service delivery plan into our future. The service delivery plan will be presented at the Strategic Planning Committee on February the 9th. This plan is the culmination of more than a year of work and will serve as a roadmap to guide the recentering of Central Health's work as we wind up the work under our current strategic objectives and look ahead to the next several years. This is one of many discussions we will have that lead to building a better, more equitable healthcare system, ensuring people with low income have access to comprehensive, high quality, and affordable care, so everyone in Travis County has the opportunity to be well and live healthier. This is at times a complicated report, but extremely important. So I encourage all board members to listen carefully. And if anyone has questions during this presentation, please present your question at the time so that it will be noted and the question may be answered at the end of the presentation. Will Murphy from K Strategies will be presenting, and Monica Crowley, Ted Burton, and Yvonne DeVega will be available to answer questions. No motion is necessary. Agenda item 3, confirm the next Strategic Planning Committee meeting date, time, and location. So we will start with the Strategic Systems of Care Planning presentation. Thank you. And thank you, Mr. Murphy.
Thank you. Thank you to the board and the Strategic Planning Committee. I appreciate the opportunity to speak tonight. Could you advance to slide 3, please? Next slide. Since October of 2021, I've had the pleasure of working with the Central Health Communications and Engagement team on the voice of the community. The team is so dynamic and professional, and they have truly been creative in finding ways to better understand the community. Today, I want to show you some of the ways and many things we have found on this journey and the results of the systems planning work that was done. Next slide. As you know, in October 2021, Central Health embarked on an equity-focused systems planning initiative to develop a comprehensive, high-functioning healthcare safety net system in Travis County. A critical first step in the initiative was understanding the health needs of low-income residents. With that in mind, we began to gather opinions and feedback. We stratified the responses to help explain how various parts of the community responded to the surveys, focus groups, and other outreach tactics. We believe that during the voice of the community engagement, we were able to reach a wide demographic cross-section of people, gather their input, and now we are prepared to make recommendations. Here are some key takeaways we recognized. One, people really appreciated the opportunity to provide input. Two, MAP is making a difference in members' lives. Three, there is a need for additional education about benefits and resources. 4, language barriers exist for patients when accessing and navigating the system. And last, the wait time for appointments and patient-provider communication are both critical issues for patients. Next slide. Central Health's engagement team was instrumental in helping us connect with influencers and leaders to participate in the focus groups, listening sessions, and surveys. We use different tactics that will be discussed later in the presentation to meet the community where they are, hear from them, and build strong communication relationships. What we found from doing this work is that the more we sought to listen and understand, the more they wanted to share. They were sharing because they wanted to be understood. Next slide. Let's take a quick look at the work that was done. During the 3 months, we met them in person, virtually, and through phone and online surveys. October was an important month because we needed to connect with the right people and build relationships. We emailed and called groups and asked them to attend listening sessions. During the sessions, they suggested patients and other groups we needed to meet. We then hosted key events that led to additional activities in November and December. Let's walk through the activities on the timeline. In October, we hosted an in-person dinner and lunch, held virtual listening sessions with advocacy groups and institutions, and we also held numerous focus groups with individuals and organizations suggested by advocate groups and institutions during the listening sessions. We recognized the importance of sharing with others about systems planning and the focus groups, so we continued to call groups not originally available and schedule meetings with them. In November, we used focus group data to find gaps reflecting demographics that we had not reached. We then began to schedule meetings and explore other tactics to connect with those not reached. We held virtual calls with advocates from African American men, Asian cultures, and people experiencing homelessness. We were also fortunate to spend a day meeting in person with people experiencing homelessness to better understand their needs. Last, in December, we did 2 important things to explore additional tactics and reach more people. We launched phone and online surveys, then hosted 2 community conversations to talk about the project and provide ways for people to get involved. Next slide. Now that we've seen the timeline, I want to talk for a moment about our measures of success. The voice of the community is critical to understanding factors influencing patient access, connectedness, continuity, and trust, and improving health equity among some of Travis County's most vulnerable populations. We established 5 ways to measure our ability to connect with the community, and they are making sure there was participation from hard-to-reach populations. That's populations where English and Spanish are not the first language. Making sure we understood the types of outreach needed to overcome barriers and to find ways to improve healthcare in Travis County. Another measure was to exceed our key performance indicators set by the community engagement team. Then we had to make sure that the work we performed provided a thorough understanding of the voice and health needs of the community. And last, we wanted to initiate strategic imperatives and activities to increase engagement of diverse populations for the future. Next slide. Now, as I mentioned in the opening slide, a cross-section of comments from participants led to 5 areas of findings. On the left side, you can see we restated the 5 findings. And on the right side, we grouped and listed the types of participants, which include current and former MAP and MAP Basic members, community serving organizations speaking on behalf of patients, Travis County residents not enrolled in MAP and MAP Basic, community advocacy groups, and institutions. Together, these findings and participation from these groups helped us understand the voice of the community. Next slide. Now here I want to share some things to help you understand the participants. Over 300 people, including patients and low-income residents, participated in conversations about their healthcare experiences. Approximately 186 of the participants were MAP and MAP Basic members. Other participants were Travis County residents that have low income and are not currently served by Central Health. We also identified and spoke to vulnerable populations, including people experiencing homelessness. Now let's take a look at the different tactics used to reach participants, which you'll see in the area shaded in green. We had 105 participants in in-person and virtual focus groups. 120 MAP and MAP Basic members were reached by phone survey, and 47 were reached through online surveys. Last, 48 participated in the community conversations, which was 2 Facebook Live conversations, 1 in English and 1 in Spanish. Also, as of Monday, January 24th, the community conversations has had over 635 views, of which 398 were English speakers and 237 were Spanish speakers. When we look at the audience by gender, you can see that 69% of the audience was female, 29% was male. A small percentage were non-binary and others preferred not to answer. Now, looking at responses by race and ethnicity, you can see that 68% of our participants were Latino, 13% were white, 12% were Black, and 1% were Asian. Next slide. Now here we want to provide some additional information to help you better understand the participants. As you can see on the left, we had a cross-section of age groups, races, and ethnicities participate. And on the right side, you can see that 54% of the participants spoke English and 46% spoke Spanish overall. In the online and telephone surveys, we were able to speak to non-citizens, and they were 60% of the online and telephone participants. I'll give you a second to just kind of look at that one more time. Next slide. We then took a deep dive into key communities and discovered ways Central Health can help improve health. As I mentioned in one of the opening slides, in November, we looked at the data and began scheduling meetings with those who we had not yet reached. We also recognized during focus groups and listening sessions that there were several groups in which we needed to spend more time and take a deeper dive into the community to hear from participants and better understand feedback from individuals in specific communities. In speaking with Asian, Latino, African American, and unhoused participants, we recognized 2 findings that overlap across the conversations. 1, all groups expressed a need for more health education resources related to chronic disease and mental health. 2nd, all groups expressed a need for closer relationships between the community and medical services to help families access medical care and support each other in becoming healthier. During this time period, we invited participants from these communities to have a conversation about issues we couldn't cover in the initial meetings. So next, we're going to take a look at some of the findings from those conversations. Next slide. Now I want to share with you some unique findings that came from feedback from these groups. Here are 3 points that came from feedback from Latinos in focus groups that have been shared. First, participants expressed a desire for more education regarding prevention programs and resources. Second, participants shared that there is a need for alliance in helping to solve larger social and political issues and accessing healthcare. Third, participants said there is a need for more compassionate relationships that deeply look at and understand the culture, geographic challenges, and language opportunities to better connect with the marginalized populations in this community. We also heard feedback from African Americans in our focus groups, and now I want you to hear some of the points that these participants shared. In these groups, participants shared that there is a need for emphasis and understanding of patients' experiences before, during, and after doctor visits. Next, participants in this focus group shared that they want more information on chronic disease, nutrition, and mental health. Last, participants expressed a desire for opportunities to partner with families, faith-based organizations, and other organizations to build education and outreach programs for African American men and to teach families how to help them maintain consistent care and seek more frequent medical attention. Next, I want to share findings from 2 other groups. Next slide. During feedback from the Asian Advocacy Focus Group, we found 4 things. 1, language barriers exist and may be reduced by building stronger communication systems that translate documents and diagnosis in the native language of the patients. 2, patient-serving organizations in this community go the extra mile, providing rides, assistance with diagnosis, and even helping patients pick up their prescriptions. 3, the patients they help are older, do not speak English, and require assistance navigating all steps in accessing medical care. And then last, the group we spoke to wants to work with Central Health on creating preventative workshops to present at places of worship and in the community to help improve the overall health of the community. I believe that this conversation led to positive communication and findings, and that can help better understand the needs of patients this advocacy group serves. Now let's take a look at feedback from one-on-one interviews with unhoused people. We spent the day at Sunrise Church conducting interviews with people experiencing homelessness. And oh, by the way, in this section, you will hear me interchangeably use unhoused people and the word people experiencing, and the words people experiencing homelessness. We found that community partnerships like the one Central Health has with Sunrise Church provide structure, access to information, and resources that really help people living in transition. Next, we recognize that faith-based organizations have a unique position in the community. Because of their location and in partnership with medical providers, they can be great spaces where unhoused people can consistently connect with needed resources. And last, most respondents were current or former MAP members and are able to access the program because of the church. Overall, the conversation with unhoused people was pivotal because it showed a unique model where people in transition can receive healthcare and hope. Next slide. In this slide, you will see respondents were asked questions to help determine reasons why they seek medical care. During the phone and online surveys, MAP and MAP Basic members shared about the different types of medical visits they had over the past year. We realized during in-person focus groups, some people may not have seen a doctor in the last 6 months. So we asked them a slightly different question. What was their greatest health need that has not yet been met? To the left and right, you can see the responses. And from looking at those responses, here are the top responses across both. Mental health, seeing a specialist, chronic disease, preventative care, and COVID-19 testing and vaccinations. This gives a great opportunity for us to see some of the reasons why patients need to see and have seen a doctor in the last 6 months to a year. Next slide. After experiencing the focus groups, reviewing the survey responses, and developing the findings, here are recommendations that came from the work. The recommendations focus on 2 areas: connecting to the community and understanding patient needs. In connecting to the community, we believe that increasing the number of relationships with faith-based organizations, community serving organizations, advocates, and institutions will educate the communities on resources, programs, healthy living, and care. Next, hosting regular community discussions in person at places of worship and local facilities or virtually will build communities' awareness and build trust for Central Health. Over and over, patients and organizations thank the team for listening to them and praise the impact MAP and Central Health have had on their lives. Next slide. In understanding patient needs, we recognize that MAP and other resources can help patients access care and improve their quality of life. Here's some recommendations related to understanding patients' needs. From feedback, we recognize that specialty care with coordinated comprehensive appointments is needed by patients. We found that patients facing challenges in scheduling an appointment is one of the topics most often mentioned related to patient experience. Increasing MAP and MAP basic access will provide some members of the community a chance to improve their quality of life. That's a second recommendation. And then third, an ongoing discussion will be important to identify the best way to help patients with their transportation needs. We also recognize that cultural competence and more resources to communicate medical information across multiple cultures is a critical part of serving the communities. Next slide. Now, next here are 5 other things we noticed during focus groups that led to recommendations related to connecting to the community and understanding patient needs. During the engagement, wives, sisters, and other family members shared concern for the low number of men seeking medical care. The second thing that happened was patients and advocates repeatedly shared the need to help patients feel welcome and understood at locations. Convenience in scheduling appointments and direct communication between clinical providers and patients is critical. Are a critical need for the community. A better understanding of chronic disease and other patient services is important to this community as well. And then patients were delighted to participate in the events and were extremely interested in learning more about health coverage, benefits, and accessing community resources. Overall, this was a great opportunity to connect with the community and understand their needs, but also to form new relationships and opportunities in the community. Next slide. Last, I've shown you this slide once, but I wanted to just have it here as a recap of the findings and the groups that participated. Again, it was truly a pleasure working with the team to better understand the voice of the community. Next slide. So where do we go from here? First, there will be a formal report that will be delivered to Central Health's leadership on February 9th. Next, recommendations will be incorporated into the service delivery strategic plan and include additional communications and findings that we've shown you here. And then last, the team will coordinate with Central Health's communication and engagements team about ongoing outreach and initiatives in the community. At this time, if you have any questions, I'd like to open up for questions.
It appears that no board members have questions at this time. Oh, I'm sorry. I'm sorry. Manager Mustafa has a question, sorry.
few more months. Well, thank you so much for the presentation. Really appreciate it. I have a couple questions for you. In terms, you mentioned the population breakdown Asian. Did you break it down in your report? Who are what types of Asians are we talking about? Who are they? Where they're coming from? Because when we're tailoring programs for specific minority groups, and depending on where they're coming from, um, their cultures are quite different. So I was wondering if in your report you'll include differentiation between Asians.
So
So,
in our conversation with the Asian population, especially in the advocacy groups, there were some key groups that showed that were at the that participated. I apologize, and those were the Korean, Vietnamese, Burmese, and Chinese. I'm sure that just from the conversation alone, it was very clear that there are more individuals that could be communicated with and discussed and to have a great discussion about the needs of the Asian community. I have to be honest with you, this was one of the conversations that we had that was most pivotal in realizing that there are opportunities beyond what we recognized at the beginning, and having an opportunity to sit down with them gave us more insight into the community. And so these were key groups that were participating at the time, but I'm sure that there's an expanding group beyond that.
yeah, thank you. I would hope also in the future to reach out to the Middle Eastern communities here in Austin, because I don't see any representation in that. And in terms of places of worship, what places are you referring to? Are they just churches? Or are we talking about synagogues, mosques? So further clarifications of places of worships. And my last question, I'll just leave it. You alluded to chronic illnesses. Which chronic illnesses were they more concerned? Was it diabetes, hypertension, cancer? So chronic illnesses can be very broad. So more specific will be helpful for us. Thank you again.
Okay. I have to take your first question. Could you repeat your first question? I apologize.
Yes, my question was places of worships.
Okay, so one of the things that we recognize in meeting with different individuals is that there is a very large faith-based community, and so we looked at the different groups, and they all represent from churches to mosques, and even some community centers where people gather. And so that's one of the reasons why we said faith-based organizations, because it's not singularly defined. It was defined based on the different groups and who we met. And so they would determine when meeting with Central Health about getting, preventative care and other educational opportunities to speak to them where they would meet. And so it wasn't singularly focused on just churches. It was really about faith-based organizations or what particular groups spoke with us.
And the next one, next time I'll break it down. We'll just do one question at a time for you. My last question was in terms of chronic illnesses. Which type of illnesses were they referring to?
So we had a myriad of chronic illnesses that were mentioned during the focus groups. Heart disease, cancer, high blood pressure were some of the key ones that we heard repeatedly. But it literally was across the spectrum for different chronic illnesses that were indicated. And I can go back to the one slide that kind of talked a little bit about some of them, but it was across the board. That literally, that was part of the reason why they wanted more education, is because there's such a broad spectrum of high blood pressure, high cholesterol, diabetes. They were all mentioned in the study.
Thank you.
Manager Jones?
Charles Bell.
Oh, no, sorry. Sorry.
That's all right. Everybody gets us confused. Will,
I had my hand up.
oh, did you have your hand up? I'm sorry. I did too. And she said
Okay. Well,
Manager Jones.
you go ahead. I'll follow up after you, Dr. Bell.
Okay.
And I'll go after y'all.
All right. Sounds good. Well, first of all, thank you very much for this work. I think it's excellent as far as the information that you've brought back to us. From what I can sort of understand by some of the comments, and correct me if I'm wrong, is that there may need to be some adjustments on our community engagements to reach different populations that you talk to. In the fact that we may think that people are knowledgeable about our services, but what I'm seeing in these comments is that there are a lot of people, especially those that you interviewed, that are not very well aware of the services that we offer or how to obtain those services. And so I assume, and again, Will, correct me if I'm wrong, that in the formal report or in the report, there will be some recommendations based on these comments that you outlined to us with regard to strategies that we might be able to, for lack of a better term, add on to what we already do that will enhance these and deficiencies is the only word I can come up with right now in our communications and engagement. So would you just comment on that and tell me whether, and Monica, I see she's raised her hand. So just tell me if I'm going down the right road with this or am I totally off base?
Monica, would you like to address that?
Yes, I'll just address it kind of overall with the structure of how the different assessments are kind of foundational. We've got the information from community members, from quantitative data sources, from other assessments that roll up into recommendations and high level kind of strategic activities that will be recommended in the service delivery strategic plan. So the voice of the community engagement assessment has gathered information from these different community members, and the comments and recommendations that come from this assessment. There's going to be a more formal voice of the community report that includes more detailed information about who was spoken to, about some of the findings from that report. And then the information from that report will be combined with information from the community health needs assessment and the capacity, current capabilities and gap analysis assessment. That those assessments are going to be presented next week during the special called Strategic Planning Committee. And all of that work is the foundational information that leads to the recommendations that are going to be in the service delivery strategic plan that's going to be presented to the board in 2 weeks. So yes, you're headed in the right direction, Dr. Bell, that there will be recommendations for priorities and objectives and some different activities in the service delivery strategic plan. And then after that, we go into, and one of the reasons that it's a priority for us to, do these presentations and have the board take action on that strategic plan is because that is going to help direct our work as we're developing fiscal year 2023 budget recommendations, and working on what programs we're going to bring to the board for funding in fiscal year 2023. And then it also rolls into phase 4 of this work, which is the financial sustainability and the operational implementation planning, which we will also have community engagement and continued work with stakeholders and partners. And we've worked with stakeholders on developing the community needs assessment and the capabilities and gap assessment. We've worked with leaders from Sendero and from community care and from representatives from the hospital systems. But these are all so in depth that we didn't think it was fair to ask you guys to do, a 5 or 6 hour board of managers meeting to see it all, in one go, which is why we're spreading out these different reports over a couple, over 2 or 3 meetings. So, and Will, if there's something more specifically about the voice of the community and how that's rolling up into the other plan.
So I think, Manager Bell, one of the things that we've done here is find opportunities. This is not the full population represented, it's a sample. And so qualitative information like this helps you get the opportunity from an engagement perspective to go back and to take these questions, to take these responses and begin to ask more questions. The other thing that's really great about what we've done is along the way, the engagement team has built even better communication relationships with every meeting. Even Paul being here tonight, we just met with him a few weeks ago, and it was an opportunity to talk to his group. So I believe that what really you see is the opening of doors that have already maybe have been open, but now people understand and they have something really centrally to focus on that will help them participate and work with the engagement team to better understand how this all works and how we can better help.
Thank you both. I appreciate that.
And Manager Jones?
Yes, I'd like to thank you very much. The report was very helpful. Monica, your response was helpful. I just want to make sure that the essence of what came out of this effort is not lost in the bureaucratic, overly complicated strategic planning effort, because there are some specific things that came out that I think should be incorporated. So I just want to make sure that goes forth as well. 2 quick questions. One is, in your survey, you mentioned African-American male. So I was very happy to hear that you all have identified and working with addressing some of the needs of our population in terms of the uniquenesses thereof. So that's one thing I want to. And then the last thing is to ask about zip coding the data in terms of your survey representatives. Did you make an effort to do it county-wide? Did you look at Eastern Crescent? Did you look all over? Is there any way to say that these representative samples are representative samples of the areas that we've identified both epidemiologically and demographically as having needs? I guess is what I'm heading.
Manager Jones, thank you for your question. We do have a map that is laid out that shows geographically the broad scope of zip codes that we were able to reach. I believe that geographically, we were able to reach a broad set of zip codes and individuals in those zip codes. And so just for the presentation's sake, we weren't able to put the map in here, but it is included in the greater report.
Well, if I may add to your response, we used the data from the demographic report and the census tract data and information to inform how we were going to be prioritizing different zip codes and areas. So we did use the data based from the demographic report to then target people, especially around the survey, the telephone survey. So specific MAP members that live in specific zip codes that we wanted to hear from. And then also when we were doing a media buy around the online survey, we also targeted specific zip codes based on the demographic report.
But did most of yours came from I thought it was in-person types of interviews or surveying. So is that skewed because the other two were smaller than the in-person, if I remember those numbers correctly?
Actually, Manager Jones, the in-person, there was a in-person, phone, and online. The phone and online were a larger audience and more specifically tracked through Central Health's database to help us make sure that we were having a broad set of participants.
Okay, so those were the larger two. I forgot what those numbers look
Yes.
like now, but
And if
okay.
you like, I can pull them back up.
No, that's okay. I just want to make sure that it's a representative sample of the community demographics that we're looking at. It sounded like Yvonne said it was, so that's helpful to know. Thanks very much. Appreciate it.
Welcome.
And Manager Valadez, do you still have a question?
Oh, yes. So what your findings are, thank you very much, Will, for you and your team, because what I'm seeing is that your findings have proven and confirmed to me and to many others that this is exactly on point with what we have suspected all along, that didn't have confirmation. So we've known this. What you're telling me is information we've already known and suspected, just didn't have the proof. But what that also says is that we are still failing to reach Hispanic males. We're still failing to reach the people that are outside the digital divide, that don't have access to the internet, are not able to use it. They can't use a computer. They don't have access to free Wi-Fi, etc. The Middle Eastern males or those from other countries are not there. They're not there in what you have told me with respect to the demographic that you presented. And so in your map, Yvonne, I'd like for you to be able to show me, if you have like little dots, that if we know the demographic of Travis County and that 200% FPL and the uninsured population, then we should have a field demographically for who we need to get and where we need to be in order to get their responses and their input. And that's very important, because if you don't have that, then what you've done is excluded them again from participating in this process, which is going to prove to be huge, great. And I'm glad actually that we're doing this, but I hope Will and the Central Health team, you'll be able to work with overcoming those gaps in communicating and receiving input from those populations, because I think we really need to have it. And I'd like to know whether or not we're going to have any public meetings so that someone can come to the table, or they can participate via Zoom, or send in something. Are the online surveys going to remain open? Is there going to be responses received maybe at the community care clinics for those that are not even participating in our population? I mean, in our programs, which is, it was close to 200,000 a long time ago, uninsured population in Travis County, much of which does meet our eligibility requirements. We just haven't accessed them, and we need to access them, okay? Because that's why we were created. So do you have a strategy for reaching them? And how are we going to get those people that you have shown us and told us that we failed to reach already?
Thank you, Manager Valadez. So after we finish the report, part of what I'm going to do in the process is we're making recommendations and having conversations with the engagement team to further talk about what the next steps are in terms of reaching those individuals that were not reached. I think during this time period, there was not only a tremendous effort to call, email, and do different things and have meetings at different times, unique times in the evening, on Saturdays, on Sundays, to try to reach the audience. I do believe there's incremental work to be done to find those individuals that you don't see on the pages. And I do believe that this team is committed, just from the work that we did together. I can tell you this team is very good at finding ways to find unique people and unique opportunities to reach people. And so I do believe that in giving those recommendations, there will be additional work to find those voices that you did not see, or you felt that you may not have seen as representative in numbers in the report that I just showed.
I
And
want to thank you for that, Yvonne, but you know Hispanic males aren't there. And I would think that Middle Eastern males are not there either. And other communities, males are not there because, you know, the huge proportion of people that responded were female. I mean, and I get that societal indication, but we do really need to reach those men. And Shannon and Maram, I appreciate you all bringing that up to the, you know, to y'all. But are we going to get them, Yvonne?
absolutely, Manager Valdez. As Will said, we are committed to reaching the most vulnerable populations, including the ones that you've mentioned. As we executed on these strategies, we pivoted our efforts. As we were learning who we were not reaching, we pivoted our efforts and we evolved our strategies. So we were able to learn how to reach those hard to reach populations better, more efficiently. And we will continue to do that, as Will mentioned.
Gamma, don't forget, hit Gamma up, hit Amin up, hit Frank Fuentes with the Hispanic contractors, you know.
We
Be
did.
sure
Thank
to
you.
hit them.
Thank you, Manager Valdez.
No, thank you.
Mr. Giesland, did you have a comment?
I want to make sure Manager Valdez had concluded her comments or questions.
Yes, thank you.
All right, thank you. Thank you, Madam Chair. Now, actually, Yvonne Davila said precisely what, in fact, I can't say it any better, just in terms of pivoting based on these strategies. And that's something else that I need to point out for the benefit of the board and the communities, that, you know, this is, you batch the work up when you get to certain milestones, and we come and we present this. This is not the end all be all by any means. And certainly, you know, we appreciate this feedback because it validates, you know, what we know are the next steps, and knowing that we have your support as a board is important to us as we go out there and do these pivots, as Yvonne has suggested. And then lastly, you know, Manager Valdez, if I could call in on a term that you were using regarding failure. You know, I think what I've taken away from this, and I'm speaking for myself on this, but is reaching people and earning people's trust to compel them to action are two totally different things. Failed to reach, you know, I would submit to you, Manager Valdez, that, you know, having seen not only our staff, but our community partners that we work with, and our vendor partners that we work with, have been out there in the communities in ways, even pre and post pandemic, that have been exceptional. I think where we fall short is on the latter part, not reaching, but the latter part, which is earning that trust and compelling a meaningful and impactful call to action. And that's where I think I'd like for you to consider that as we're moving through this process. What is a failure and what is not a failure? But thank you for allowing me as much. I appreciate it, Madam Chair.
No, I appreciate that, Mike, and I didn't mean a failure as such, but it is a gap that we need to overcome, because it's a gap that we're trying to fill as we develop a transformational system that is equity oriented.
Yes,
Using
thank
that
you
lens-
so much.
so
Thank you
thank
so much, Manager Valdez.
Understood. Thank you.
And Mr. Murphy, would you like to continue? Yes.
I just wanted to say one thing, that of the male population, the Hispanic male population was the largest population that we heard from. And there was about 18% of the population was Hispanic males. And as was just said, this built trust. The repetitive and repeated, thank you for talking to us, thank you for hearing our voice. This was a huge opportunity to build trust, and those doors are open. And so I really believe that there's a great opportunity next for this team to gain opportunities with the community and do the work, and it will be great.
No one answered whether or not we were going to have a public meeting, so that the public can provide input and hear all of this, not just someone in a Zoom meeting for Central Health.
If I may add, we did have 2 public meetings, as Will mentioned during the presentation. This took place in early December, and they were via Facebook Live, one in English and one in Spanish. And, we will continue to engage with the community. Up next, as Monica mentioned, up next are, if I can even say this, our fiscal year 2023 strategic priorities that will be based on the strategic healthcare delivery plan that will come out of this work. And so we will continue that ongoing engagement.
Thank you. I just was wondering how we're going to cover or reach out to the people that don't have Wi-Fi or online or internet. That's another consideration.
We thank you, Manager Valdez. I'll quickly just mention that we had a couple of community meals, one at Dobie Middle School and one at the Southeast Health and Wellness Center, where we had a catered meal and had a great conversation, in-person conversation with people. And a great majority of them were MAP and MAP Basic members and other people that were specifically targeting people with low income.
No, I know about those. Thank you.
Sure.
Any further questions from any board members? No. Mr. Murphy, do you have anything further to tell us tonight?
I just want to thank Central Health and the engagement team for this opportunity. I want to thank the board and the committee. This is excellent work, and this is only a fraction of what we have to say in the report, and it's going to be well worth reading, and I'm very excited for the work that we've done. Thank you.
Oh, we thank you very, very much. It's been very informational so far.
I have one quick comment or question. Will there be an opportunity for the entities, the enterprise members, to meet to talk about what they are doing right now and how we can maybe expand and improve upon that system correctly? I mean, as we move forward.
And Manager,
say something that y'all were meeting.
Yes, and so there is a strategic planning advisory council that is one of the groups that has been giving feedback on this entire effort. Dr. Mary Carol Jennings is a representative that has participated in those meetings from the beginning. And I see that the CEO of Community Care Health Centers has been on this call, and he has had 3 representatives from his senior leadership team, including his chief medical officer, chief operating officer, and chief strategy officer, participating in those meetings, and also has been participating and giving feedback on this work throughout.
What about with Sendero?
Yes, that's Dr. Mary Carol Jennings.
Oh, okay. Okay, thank you.
Officer at Sendero Health Plan.
Oh,
sorry,
no,
I was
I
unclear in that. Sorry about that.
Thank you.
And we are also meeting with the CEO of Sendero Health Plans, Wester Kulski, to make sure that we are we're aligned in our planning effort. So thank you for bringing that up.
No, thank you, Monica.
Yes, thank you, all of the board members, for your input. And so there is no motion necessary on our last presentation. So we're going to move forward to item number 3, confirm the next Strategic Planning Committee meeting date, time, and location. Managers, our next Central Health Strategic Planning Committee meeting is special called meeting. We will continue this discussion with the phase 2 of this collaboration that we have asked for, and it is tentatively scheduled for next Wednesday, February the 2nd, 2022 at 1 p.m. at the Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702. And at this time, which is 6:16, I am ready to accept a motion for adjournment.
So moved. I move to adjourn.
So yes, Manager Valadez, thank you for that. And a second, please. Yes, and Chair Bell, thank you so much. And if there's no further business, we are adjourned.
You have to vote.
Oh, we have to vote. Okay, so would everyone vote, please, on the motion to accept this? Aye. Aye. Yes. Okay, thank you so much. All right, so we are adjourned.
Thank you, members.
Thank you.
I'll get it.
Sorry, Dr. Brinson, I just realized I'm not on the committee.